On Thursday, the 29th of June 2017, the Prime Minister, along with several government delegates, embarked on his previously announced Meet the Workers tour. The intention of this tour is to give the Prime Minister insight as to some of the daily challenges faced by civil servants. Nicole MacDonald, Senior Communications Officer for the Government of St. Lucia, describes the tour as a platform for employees to dialogue directly with the Prime Minister regarding issues affecting productivity and efficiency in the workplace.
Throughout the rest of the year, the Prime Minister will be stopping off at different places in order to meet the workers one-on-one so they can voice their concerns directly to the Prime Minister. Today we're at the St. Jude Hospital, which is now located, unfortunately, at the George Odlum Stadium. So the Prime Minister has been walking around to the different offices, to the different persons, the different wards, the lab, the pharmacy, just to get a feel of what exactly people are going through being housed here at the stadium. We know it's a very difficult environment, and in our efforts to finally get the new hospital up and running, we want to ensure that the hospitals are equipped with what they need in order to run successfully.
Verna Charles, CEO of St. Jude's Hospital, expressed the appreciation for the hospital staff for the Prime Minister's visit and voiced some concerns for the operating conditions at the stadium.
Most times, persons in the south feel very neglected, that we do not get this opportunity, and most of it is within the north of the island. So I think all the staff are very elated about this visit. I think one of our major challenge being at the stadium is just being in the stadium, not being able to have the proper equipment, adequate staff to provide the quality of services that we'd like to give to the people in the south of the island. But despite all of those challenges, we are still able to provide a full complement of services. But on a daily basis, for example, our X-ray machine would work for 1 week, and the other week it would be down. We have to fly a technician in out of Barbados or Trinidad to come and assist us to repair the equipment. We have issues with our chemistry analyzer. Right now, we don't have special chemistry. We have to use the private sector to give us that level of support. And of course, the inflated cost in going out to the private sector is at a cost to the clients that we serve. So we are challenged all around being at the stadium.
Prime Minister Honorable Allen Chastanet empathized with the frustrations of staff and patients and noted that efforts are being made to expedite the move into the new hospital.
People are frustrated. It's the age-old dilemma that when we have old buildings and things are not functioning and we're waiting in hope of something new, and very difficult for people who are having to deal with the deficiencies on a daily basis to understand why they have had to wait for so long. And so if you're not moving into the new building, then why can't we fix what we have? But everybody is scared to fix what we have because everybody lives in the hope that we're moving into the new hospital tomorrow. And so I'm moved at that the capacity of the people here and what they have done, but I'm also very sensitive to how frustrated they are. I'm also sensitive to the patients, who clearly would sense some level of frustration. I wish I could just wave a magic wand. I wish I had the ability of just saying, let's move into the building tomorrow, so it's not, unfortunately, left up to me or anybody else to be able to move in the building tomorrow. It's very, very sad that here we are almost 7 years later since the fire, and we're no closer to moving into the building than we were before. It's very difficult, one, in terms of the amount of time that's passed by, two, in terms of the amount of money that's been spent. According to the report that we've received, the report that's been made to Cabinet, unfortunately, a lot of the rooms were not built to specification. So, for instance, even when you have rooms that are supposed to have operations in it, it was not designed to be able to put the equipment in. So even if we wanted to move in tomorrow, we couldn't, even if the room was properly codified. You have rooms in which beds can't even pass by. So unfortunately, the facilities are not ready to be moved into. What we've done as a cabinet, because of the frustration, because not only of the frustration, but we've really, I think, gone past the expiry date here at this facility, can we downsize the expectation, so in the terms of the number of beds, prioritize some of the things, the dialysis, the emergency ward, the operation room, can we move in there and at least get those things functioning, and meanwhile get some of the other things rectified. So there was a report that has been done on a way forward. I know that there's been a meeting with the St. Jude's board. There's now a meeting with the Ministry of Finance in terms of how quickly we can get stuff started up again, so we can try to get into the new hospital as quickly as possible. And so certainly we're not talking about a year. Idealistically, we would like to move in by the end of this year, but I think the minister is uncomfortable at this point of making that commitment. But certainly no less than 1 year we should be in the facility, and if we can get it even quicker, we will.
Since the beginning of the tour, the Prime Minister's visits included Victoria Hospital, SLASPA offices, and other governmental departments. The tour will continue throughout the rest of the year. Reporting from the Ministry of Health and Wellness, I am Miguel Morissette.